network leadership team, and I'll serve as moderator for today's webinar. In our diverse, multicultural, and multilingual society, interpreting and translating are crucial to the delivery of quality services and supports. We hope that today's webinar will drive home that point and leave you with some tools and insights useful in your work. Before I introduce our distinguished speaker, I would like to go over a few housekeeping details. Because of the number of participants today, your telephone lines will be muted throughout the call. However, we welcome your questions and comments. You can submit these at any point during the presentation via the chat or question box on your webinar console. We are planning to stop twice to respond to questions, once at the midpoint of the webinar and then again at the end. To save on time, I may combine similar questions into one, and if we get too many questions, I'm sure our speaker will try to respond offline. I'd like to inform you that this webinar will be recorded and archived on the network website, www.nj.gov/njsncc. Finally, a short survey will pop up on your screen immediately following the webinar. Your feedback is so important to us, and we would appreciate your taking the time to fill it out. Now I'm delighted to introduce today's presenter. Hank Dahlman is director of the New Brunswick Community Interpreter Project and a faculty member in the Department of Family Medicine and Community Health at Rutgers Robert Wood Johnson Medical School. He is also a certified healthcare interpreter, interpreter trainer, curriculum development specialist, and language access consultant. Over the years, Hank has championed the cause of language access. He has led many skill-based trainings for students and professional interpreters, as well as workshops and presentations to healthcare providers and stakeholders about language access. Hank holds an MA in Spanish Translating and Interpreting from Rutgers University, where he has been an adjunct professor since 2001. It gives me great pleasure to turn the floor over to Hank Dahlman.
Thank you very much, Nick, and thank you very much, everyone, for joining. We're going to be talking about community interpreting best practices and the standards related to them. This is something that I'm very passionate about, and I hope that in the time that we have together that we'll be able to give you some very relevant tools to come away with. At the same time, this is a very big discussion, and so I would urge you to think of this as a starting point and not necessarily all the answers together, but this is something that we hope to start a bigger discussion. As far as learning objectives, I'd like to start with making a difference between translation and interpreting. I want to identify the skills and qualifications needed to be an effective translator or interpreter, discuss the different types and skill levels of interpreters. I want to review the current national standards for training interpreters and the Office of Minority Health's CLAS Standards regarding language access. I'd like to try to describe how these standards can be practically applied on the ground. And then finally, I want to share resources for further learning about community interpreting. I'd like to start with some basic definitions and a little bit of history of interpreting. So is there a difference between a translator and an interpreter? There is a difference. These terms are often confused and used interchangeably, but in the professional sphere in which we work, there is a big distinction. And so interpreting is where someone renders a message orally or signed from one language to another. And translation is where a written message is rendered from one language into another. These are very common definitions, very used widely, but they do focus really on the end result. So if the end result is spoken, it's interpreting, and if the end result is written, then it is translation. But there are many similarities between the two. And so, for example, people who work as translators or interpreters must have good language skills. So either spoken language skills or written language skills in two languages. So, English and another language. Or two other languages, French and German, Spanish and Chinese, if those are languages they work in. But they need to have good language skills in both. Translators have time to research, revise, and edit, whereas interpreters do not have that. They usually work bidirectionally. In other words, they are going from one language to another and back and forth. Both translation and interpreting are sensitive to cultural elements, and so culture isn't left out in either one. Translators, as I said, have time to research, revise, and edit. Interpreters must think fast on their feet, and so they don't really have the luxury of being able to come up with the best answer. They have to come up with the best answer at that moment. So those are some other similarities and differences that go into it. Now I'd like to talk a little bit about the different sectors of the interpreting profession. And so probably the most well-known to most people outside of the field is conference interpreting. Conference interpreting is what takes place in the UN, the EU, the State Department. It's sort of that level of interpreting. This is sort of the, I guess, the highest level, not in importance, but the highest level of what our field is. Next, we have legal interpreting. Legal interpreting encompasses anything that takes place in superior court, municipal court, federal court, but even things like legal aid societies and other immigration, anything that's sort of court or legal related would fall under legal interpreting. And then lastly, what we're going to be focusing on today is community interpreting. And so we define community interpreting. Oh, sorry, before I get to that, I want to just make one distinction, is that this talk will be, today, we're going to be focusing on spoken language interpreting, and we're not going to be talking at all about American Sign Language interpreting. And the reason for that is that American Sign Language interpreting has developed out of different laws and standards. And so ASL interpreting, while it is interpreting and part of the interpreting profession, is sort of a separate sector of the interpreting profession. And so an ASL interpreter would work in conference, in legal, and in community interpreting. And again, that they work under sort of a different set of standards, and they're a different set of laws, mainly the ADA, the American with Disabilities Act. So we're going to be focusing on spoken language interpreting today. Now, there are different types of interpreters, and so I think it's important to understand the distinction. We have staff interpreters, people who only interpret and don't do other jobs. There are freelance or contract interpreters, so people who are not part of an institution but are contracted to come in and interpret. Dual role interpreters are people who have one job to do in an institution and then are also trained and used as interpreters. For example, they might be a receptionist, a med tech, a nurse, a counselor, an administrator, and then also have language skills, and then therefore is trained and uses an interpreter. So basically, they have two roles to do. Paraprofessional interpreters, people that have training, that are qualified and have training, but not at the same level that staff or freelance interpreters would have. And then lastly, ad hoc interpreters. These are people that interpret, on an ad hoc basis, generally do not have training or haven't had their competency checked, interpret now and then. And then lastly, telephone interpreters, interpreting over the telephone. So I listed face-to-face because the top 5 are generally obviously done face-to-face, and telephone interpreting is you don't get the face-to-face contact there. Now, as far as the definition for community interpreting, we define it as interpreting that takes place in healthcare, education, or social services. And so this is a sort of a distinct sector, again, from legal or conference. Legal interpreting has a different set of standards and laws that govern it in the same way that conference interpreting does. So again, we're going to be focusing on this area of community interpreting, in particular healthcare, education, and social services and their standards. Now, what I just wanted to point out something that the Code of Ethics, the Standards of Practice, the government standards, the training and testing template, all the things that we're going to talk about today really apply in the 3 areas that I mentioned. So you'll see that sometimes it says patient or in healthcare or healthcare training, or but the standards that we're going to be talking about really apply in any of the areas. They apply in healthcare, they equally apply in education, and they equally apply in social services. The healthcare sector has been the most developed, the most professionalized of the 3, and so most of the standards and publications usually use that terminology. And if I do throughout this talk, I just want you to know that whatever I'm saying applies equally to the other areas. So as far as history, I mean, we can say interpreting goes back to the ancient Egyptians. There are hieroglyphs that we know that represent interpreters, and they have nice images throughout the history as well. We can point to other interpreters, other famous interpreters. Many Native Americans, for example, Sacagawea, Pocahontas, Squanto, all acted as interpreters at different times as you know, things were developing in this country. Conference interpreting developed after the Second World War with the use of simultaneous interpreting. But as far as the development of community interpreting, it really starts in the 1970s in this country when there was a huge flux of immigrants. Now, of course, you know, there's been a very long history in this country of immigration, but around the 70s is where we see sort of a spike in immigration from, let's say, non-Northern European countries. And so it brings up the certain language issues. In the 1980s, what happened was that friends and families interpreted in the community services. So in doctors' offices, in hospitals, in school systems, friends and families were the interpreters. In the 1990s, particularly in the mid-1990s, healthcare interpreting arises as a response to concerns for patient safety. So if you're having friends and family members interpret, it brings up a lot of issues as far as patient safety and effective interpreting. And so these responses came up to that, and they started to look to develop trainings that would address these issues and get people, get qualified people in there to interpret. So in the 2000s, we have basically two 40-hour trainings that were developed, one for healthcare and one for community interpreting, which is the one that we'll be talking about. In the mid-2000s, we have the publication of the Code of Ethics, Standards of Practice for Healthcare Interpreters, and they were widely adopted throughout the U.S. And again, because they were ethics and standards for healthcare, doesn't mean they only apply in that sector, but would apply equally as well and effectively in education or social services settings. Now I'd like to talk a little bit about interpreter skills and qualifications, now that we know sort of what sector we're talking about and so forth. An interpreter, this is the definition that we use. It comes from the NCIHC, which stands for the National Council on Interpreting in Healthcare. An interpreter is a person who renders a message spoken in one language into a second language and who abides by a code of professional ethics. And so to me, I'd like to point out that that what is really important about this definition is the second part of the sentence, the second phrase, and who abides by a code of professional ethics. Many people who are bilingual, even children, have the ability to render a message spoken in one language into another, but it doesn't necessarily make them an interpreter. It is that extra component of abides by a code of professional ethics. And that can be challenging, and we're going to look at what some of the ethics are and give some quick examples. Now, as far as the interpreting process, it is the process of understanding and analyzing a spoken or signed message and re-expressing that message faithfully, accurately, and objectively in another language, taking into account the cultural and social context. And so this is the challenge here is, and we have the ethical principles right in the interpreting process, faithfully, accurately, objectively, and the presence of culture. So right in the process, we already can see the presence of the ethical principles. And the process of understanding and analyzing a message, we're going to see how challenging that can be. This is just a graphic that points out the different steps in the interpreting process. It's sort of a visual of the definition that we just gave. And essentially what happens when an interpreter interprets is that somebody says something, and then the first thing they have to do is comprehend the message. They need to understand it fully. They need to process that information, right away as quick as they can. Who's saying what to whom, all the elements of that information. Then they need to store that information in their short-term memory. Then the next step is accessing the long-term memory. The long-term memory is where we've stored everything that we've learned. So if we've studied certain terminology, certain subject matter information, about education, about healthcare, about social services. If we've learned, if we're interpreting in a language that a second language that we've learned, this is where we store all the grammar and everything that we've learned. Then we need to combine the information in our short-term memory and our long-term memory to reformulate that message and then deliver it accurately and completely to the other party. And then once that happens, then it starts all over again. Then somebody says something, and then we have to understand it, process, store, access, and reformulate. And this is the cycle that interpreters go through each time that they interpret. This is challenging. It's taxing mentally. It's tiring. It requires a lot of focus. As far as some qualifications, basically these are minimal qualifications to be considered an interpreter. You must be 18 years or older, hold at least a high school diploma or equivalent. You must demonstrate bilingualism and literacy through language proficiency testing, and you should hold a certificate of professional interpreter training at least 40 hours. Anything less than 40 hours is not considered a training, it's considered an orientation. The skills that we would look for in an effective interpreter is active listening, message analysis, and conversion. Again, so we're thinking about the first two steps here is when you have to understand exactly what's being said and you have to analyze that. In order for interpreters to be accurate, they should have good note-taking skills. Okay, I mean, this is not sort of stenography like you see in court, and it's not writing down everything that's said. There is a certain technique to it that is usually covered in trainings, but they need to have some level of note-taking skills so they can be accurate and complete. They should maintain the register of what's being said. This is important for health literacy. Maintaining the register effectively means that if something is high register, it's, like sort of, for lack of a better term, sort of big medical terms or something, they need to say the same thing in the other language. It's not an interpreter's responsibility to lower it, to clean it up, to make it more understandable. Interpreters should have good memory skills, and they should have the skill of self-monitoring and self-assessment, because, again, they are the only person in the room that is bilingual, and so they are the only ones that are going to know how well they're doing, if they're accurate, if they're complete. I want to stress again that these are the minimal qualifications. We would love to see, maybe some higher qualifications, but again, these are the minimum. Now, as far as qualifications to be a translator, we roughly the same. You meet 18 years old, should have a high school diploma, demonstrate bilingualism, but this time it should be written, and they should hold some type of professional certificate of translator training or an academic degree in translation. I can tell you that here, although it's not required, that someone without some university training will not make a great translator, because it relies so much on writing, academic writing. Skills for this, you need to have very strong written skills, good research skills, good editing and proofreading skills. Again, because it's we're dealing with written documents. One thing that I want you to take away from this is a common confusion that people make, is that being bilingual alone does not guarantee that an individual can interpret or translate effectively. This is a very common misunderstanding that that be bilingual automatically means that you can interpret or translate. It's not the case. Being bilingual is a great first step. It means that there is the potential to develop into an effective interpreter or translator, given some of the steps we're going to talk about later. But just being bilingual alone does not guarantee effective interpreting or translation. Now I want to give some examples because we said that you need to understand and you need to what's being said. You don't have much time to do it, and to be able to reformulate it effectively. And so this is a common example of something that might be said. And so if you read this, you can't get pregnant while you're taking this medicine. Does this have one meaning? Does it have two meanings? Could it mean different things? And so as an interpreter, you need to hear this. You need to understand what all the possible meanings are, and then you need to make a decision about what the meaning is based upon the context. So something like this could mean that it's impossible to get pregnant while you're taking this medicine, so therefore you don't have to do anything else to, avoid getting pregnant. Or it means that you should not, under any circumstances, get pregnant while you're taking this medicine. And so you could see how, a misunderstanding of this simple sentence really could lead to a very big error in interpreting. Now we have another example here, and this is something that happened to me not too long ago. I went in with the nurse practitioner, and she walked in the room, and I walked in the room behind her, and she looks at the patient, and she says, "I don't like your face." And I said, wow, what does this mean? And so what the context here for this encounter was that this patient was suffering from a type of Bell's palsy or something and really wasn't getting any better. And so what she meant is, I don't like the condition of your paralysis, or I don't like the condition that your face is in, or the status, or the progression of your face. And now you can imagine that if I interpreted this into Spanish literally, I don't like your face, it would mean nothing, So again, these are just two examples to sort of highlight that graphic that we just went through about the first step really is understanding completely what's being said in the context, and then storing that in your short-term memory, and then finding the equivalence for that meaning, and then delivering the message. So now I would like to talk a little bit about the interpreter ethics and standards, because again, that is an important part of the definition. It's being able to take something said in one language into the other language and following a code of ethics. Now, the NCIHC, as I said, the National Council on Interpreting in Healthcare, is an organization that has published the standards of practice and code of ethics for us. In the mid-90s, as I said, they got together and they came up with a vision that would eventually lead to certification. And the steps that they did in creating this profession of healthcare interpreting, again, which all the principles in healthcare interpreting would apply equally in education or social services, their first step was to establish a code of ethics. Then from there, standards of practice, then a set of standards for training programs, and then they've also published various other papers and resources throughout the years. And their plan was that this would culminate in a certification. And the time frame that we're talking about here is 2005 to 2011. These are images of the front page of the two documents. The Code of Ethics in 2004 and the Standards of Practice were published in 2005. I call these foundational documents because they are, they make up the basis, the foundation of a profession, of our profession of healthcare interpreting. Any profession, has a set of code of ethics, doctors, lawyers, nurses, and so forth. And so it's important that we had this too to advance professionally. Now, the purpose of the Code of Ethics was to establish for a growing profession a set of shared, essential guiding principles expressing what are considered morally appropriate behaviors for its practitioners as they perform their day-to-day duties. Basically, in other words, what they tell anyone who interprets what they must do, and they tell people who work with interpreters what they can expect from interpreters. These are the 9 principles in the Code of Ethics. Okay, I'm not going to talk about them in any detail, but you can see what they are. I mean, they're pretty self-explanatory on the face, although there's a lot we can say about each one. But I would just highlight, for example, accuracy, impartiality, professionalism, cultural awareness. Now, the standards of practice really grew out of the Code of Ethics. They're organized around the ethical principles. And the purpose of the standards of practice that we have, they're the guidelines, the best practices that define acceptable ways by which interpreters can meet the core obligations of their profession, the accurate and complete transmission of messages between patient and provider. Or in other words, they tell anyone who interprets how to interpret. So a lot of times we think of the Code of Ethics as the destination and the standards of practice as the roadmap. How do we get there? Okay. Okay.
So,
stop for questions? Okay.
Yeah, maybe this might be a good point to stop for questions. And we do have some very interesting questions. I hope we'll have time to get to each of them. The first question relates to professional interpreter training, and where do you go to obtain such training? do you have any suggestions? I think you mentioned the importance of 40 hours. Who offers 40-hour training?
There are a few ways that you can do it. So I'll give you a couple options. I mean, first, we offer the 40-hour interpreter training, okay, but I don't want that to be a sales pitch, but I mean, we do offer it. There are also other agencies, private agencies, that would offer a 40-hour training in healthcare interpreting. You know, the program that we offer, and we're going to talk about it at the end, is called the Community Interpreter, which is, you know, would target bilingual staff members, dual role interpreters, people who do sort of one job and interpret, or, you know, people who interpret in education, social services, or healthcare. The other program, the other 40-hour program that would be available, let's say, on this side of the country, is called Bridging the Gap, and that is a program that targets only healthcare interpreter. There's not much flexibility to cover the way the course is structured to do education or social services. So I guess in a nutshell, yes.
So you'll be sharing some of those resources towards the end. We have a question related to video interpreting, and the questioner wonders if you might discuss the pros and cons of video interpreting, I presume in a healthcare setting.
Sure, that's good, and actually I probably am remiss for not including that in the types of interpreters. Video interpreting is great. It's similar to telephone interpreting, but instead of having the phone, obviously, you're accessing an interpreter through, you know, a computer screen, an iPad, or a TV screen. And so the pluses of that is that you get a sort of a face-to-face interpreter. So and then another plus of that is you get access, you know, multiple languages. So a lot of times when you have face-to-face interpreting, like, you know, individuals in your site, you're limited to the language that they do. But if you have a video interpreting service, you get to access multiple languages, which might, you know, languages that you might need once in a while, but not all the time, and you get to access a face-to-face person. The negatives, I think, of video interpreting are the technology that's involved. It's a pretty rich infrastructure. You need to have, obviously, you know, you have good wireless, for example. You need to have IT support for the devices, you know, that kind of stuff. So I think that there's pluses and minuses. Video remote interpreting is really growing. You know, they're all different prices, but some of the things that I've seen is that it's on par with telephone interpreting, and so the advantage is that you get sort of a real person just through a screen.
Yep. So possibly this may be the wave of the future, and it's important to be mindful. One questioner is asking about the availability of this PowerPoint. It will be available for download on the network website, so have no fear. And the final question we have here is, do guidelines for becoming a professional interpreter change from state to state? Are there state regulations that we need to be mindful of?
No, no. The nice thing about the NCIHC and the standards is that they are national, that they would be apply in any state. Later, we're going to talk about certification, which is also national, would apply in any state. It's not, you know, medical interpreting, or again, community interpreting is not something like legal interpreting, where each state has a different approval process to work in court. Community interpreting tends to be, the standards are all national. So, you know, if you meet the requirements in one state, you should be able to go easily to another state, and those qualifications would be valid.
Okay, great. Well, I think maybe we've exhausted the time available at this point for questions. Keep your questions coming, because we've set aside 10 minutes towards the end for additional questions. So, Hank, do you want to continue now with the presentation?
Sure, those are great questions, and I would just second what Nick is saying. You know, keep them coming, because they're great. So we're talking about standards. Now I want to move into a sort of a separate set of standards. These are not. These are more general. So these are the CLAS standards. CLAS stands for Culturally and Linguistically Appropriate Services. They are from the Office of Minority Health in the federal government. They were first released in 2000, and then there was an enhanced version that came out not too long ago in 2013. These standards are voluntary. They're not mandatory. But when we talk a little bit about what the principle is, you can see that, you would be very willing to follow them, let's say. And so the principal standard is to provide effective, equitable, understandable, and respectful quality care and services that are responsible to diverse cultural health beliefs and practices, provide preferred languages, health literacy, and other communication needs. And so the spirit here is that it's not just delivering a service, a quality service, but a service that is responsive to cultural beliefs, that is in the preferred language, that meets their communication needs. And so it's sort of a bridge between the service that we're offering and the people that we're trying to offer to that need it. And so I think that this is important, and kind of everything else under falls into place how we can do this. Now, they're organized along three themes. Okay, the first is governance, leadership, and workforce. The second is communication and language assistance. And the third is engagement, continuous improvement, and accountability. So these are sort of institutional-wide. What we're going to be talking about is the second theme, and that's communication and language assistance. Okay, that's standards 5 to 8. Now, number 5 says that we should offer language assistance to individuals who have limited English proficiency or other communication needs, that it shouldn't be any cost to them, and that if we offer language assistance, that this facilitates timely access to health care and services. So this means providing, interpreters, having translated materials, having signage. I mean, that's what, and other devices, for a deaf and hard of hearing. So it's kind of a wide range of things that we should offer that will enable us to communicate effectively with the people that we're serving. Now, the result of this, of course, is that it increases equitable access to health care. Okay, it increases access equally for everyone. It helps patients or clients understand and adhere to their treatment or the services that are being provided to them. It certainly increases patient satisfaction or client satisfaction, and also, provider satisfaction in the sense that it's easier to do their job. Providing effective language assistance will reduce errors, and it will help organizations comply with Title VI. Now, Title VI is not something that I'm including in this, but I'll say a quick word about it because it is really important. Title VI is a federal law, and so that's why I didn't include it, because I was trying to focus on standards. But Title VI is a federal law, and it's part of the 1963 Civil Rights Act, which says, I'm sure we're all very familiar with that, but it says that you cannot discriminate against someone based upon their race, creed, or color, or national origin. And so there was a court case about 10 years after that that included language as part of national origin. So, so Title VI is a law. It's very important. It's sort of the whole legal basis of community interpreting. And following these CLAS standards would help organizations comply with Title VI. The next standard asks that we inform all individuals of the availability of language assistance services clearly and in the preferred language, orally and in writing. So in other words, we need to let them know that this service is available, and we have to let them know in their preferred language. In preferred language, someone might be bilingual. They might speak Spanish and English, but they, they speak English to one degree or another, and they speak Spanish probably a little bit better, and so they can certainly communicate effectively in some cases in English. But as far as making important decisions about their child's education or surgery, or if they're going to apply for some other services, for example, they might prefer to do it in Spanish. And so even though they might be bilingual, we have to do it in their preferred language. And this information should be given orally in writing. So again, in their preferred language. Now, the results here are similar to the previous standards. These sort of standards kind of all have the similar effects, is that they facilitate access to care. They help organizations, again, comply with Title VI. And again, this should be done in the patient's preferred language. Now, the next one And this asks that that institutions ensure the competence of individuals that are providing language assistance, recognizing that the use of untrained individuals or minors as interpreters should be avoided. So we're getting past, family members, untrained staff, and so forth. It asks that we ensure the competence. Now, what are the results here? Well, when you have competent individuals doing interpreting and translation, it ensures accurate and effective communication. It will reduce, in healthcare, it will reduce the misdiagnosis, missing information, inappropriate or unnecessary treatment, and patient safety issues. It empowers individuals. I mean, if they're getting all the information and it's accurate, they have more, they're better able to make certain decisions, so it empowers individuals. It also enables patient-centered medicine and patient autonomy, or, for example, client-centered services or client autonomy. I mean, if you're if you're a program that offers certain services, having competent interpreters enables those services to be client-centered as opposed to sort of organizationally centered. And then lastly, again, like the other ones, this ensuring competence will help compliance with Title VI. Now the question is, how do we verify competence? How do we know somebody is able to effectively interpret or translate? So again, we laid out a definition of what interpreting is and what the process is, and we saw a couple examples. How are we going to know that they're able to do that effectively? And so this is sort of a scheme for doing that. The first thing would be to have validated language proficiency testing to determine what level that person has of their language. Okay, it's not necessarily do they speak it or not, but to what level, how well do they use it, and there are different levels. Okay, and again, this is really focusing only on language. It's not. It's it's hard sometimes to separate language and cultural identity, but what they're using as an interpreter is their language skills. Second would be appropriate training in healthcare interpreting. So, and again, we have healthcare because the trainings tend to focus on healthcare, but the courses that we offer would equally apply in other areas. And so again, appropriate training means a minimum of 40 hours. So anything less is not considered a training, but more like an orientation. And then third would be interpreter skills testing. If we're going to ask an individual to interpret, we want to know to what degree they're actually able to interpret, because speaking a language and interpreting from one language to another are two separate skills. They're related, but one doesn't guarantee the other. And then finally, interpreting is a practice profession. It's something that you do and have to practice and get better at. So when there is the possibility for a practicum or an internship or some way to serve as an interpreter, under the mentorship of someone else, that's ideal. I'll tell you that of these 4 steps, the 4 of them together are sort of the ideal best practice. And we'll talk a little bit more about how to implement these, but what, if you get the first and the second one done, that's a really great start. Now this can be a real challenge. If you're thinking about the 4 steps that I did, this can be a real challenge. It's certainly an investment in time and money. If you're taking someone out of work and you're testing them, the test costs money, the training costs money. If you're testing their interpreter skills, that can cost money. All this is obviously time away from work, and if an individual is a bilingual staff member, let's say they have another job to do, and if they're away doing all this testing and training, then someone else has to cover. So that's an investment. There can be workforce issues in the sense that, let's say, for years you've relied on someone in your organization to be an interpreter, you test them, and then you find out that they don't really have the language skills according to the standards that are out there to interpret. What do you do? Can there be union issues? If someone doesn't pass the test, the proficiency test, and they can't interpret, how do you have that discussion with them in the appropriate way? So there's a lot of workforce issues that go into this. There can also be legal issues that come up around interpreting and who interprets. Now, again, we're talking mainly about spoken language interpreting, but I didn't want to leave out for translation because many people who are interpreters or who are bilingual staff members are also asked to do translations. And so if we are talking about how do we verify competence, one way we can verify competence for translators is if they have an academic degree in translation or if they have some kind of professional certificate in translation. That would be one way to verify their competence as a translator. The ATA is an organization for the American Translators Association. They offer certification. It's a very difficult credential to achieve. Their standards are very high. But if someone had ATA certification, that would be a sure sign that they are a competent translator. Okay, so moving on to our next standard is provide, it asks us to provide easy to understand print and multimedia materials and signage in the languages commonly used by the populations in that service area. And so what does this do? This will ensure understanding at different literacy levels. So some people, for example, might prefer to read in complement to what they're hearing. It enables informed decisions because people can take information in, go home and read about it, and then think about it and make the best decision. This will also supplement oral information from providers and reach as many people at once. And you can imagine in many social service settings that information is given out sort of in a workshop format, or and so people can hear the message and they can take more information home, FAQs or other things. And then lastly, like all the other standards here, this also helps with compliance with Title VI and other regulations. Now, I want to talk a little bit now about applying these standards. So we just went through, 5 to 8, and how do we determine competency? How do we apply these in sort of real-life settings on the ground in the areas that we work, again, realistically? Now, I would just ask you to first remember the big picture. Okay, remember the big picture first. That first standard that we talked about. What do the CLAS standards try to achieve? They try to bring about a service that is not only a quality service, but a service that responds to various cultural beliefs, diversity, language needs, health literacy needs. And so that's what the goal is. And I think it's important to understand what we're trying to achieve and then lay out a plan of how we can get there. So the first step I would suggest is that you should review the size, scope, mission, and risk involved in the services. Okay, because the degree that these are present will determine, what kind of testing or training or orientation or, what kind of interpreters you'll use. And I would suggest that you take a multifaceted approach. So, for example, no one solution. So not just the telephone, not just VRI, not just hiring bilingual staff is really going to solve all your needs. And so the basic solutions in order first would be bilingual providers. Okay, everyone agrees that having providers that speak the language of their clients or patients is the best thing. There's no need for an interpreter if you have bilingual providers. The caveat there is that these providers should really be bilingual. It's not that they self-identify as bilingual, but they should really be bilinguals and be able to provide the services here. And so as far as, reviewing, the risks or the scope and proficiency, for example, a front-end staff person, a receptionist, would not have to have the same level of proficiency as a bilingual counselor that might see patients in the back, for example. So that's kind of what I mean by reviewing the size and scope and risk there. After bilingual providers, face-to-face interpreters, or let's say something face-to-face is probably the best way to go. Face-to-face interpreters would include dedicated staff interpreters or contract interpreters or freelance interpreters. After that, dual-role interpreters. These are, also known as bilingual staff members who have been trained and screened. Their competence has been verified according to the established standards. And then they can act as dual-role interpreters. They do one job, and they can work effectively as an interpreter as well. Lastly, telephone or video remote interpreters, or VRI. And so these are basically your kind of multifaceted approach for this. And a real effective language services program would probably have a mix of all of those, because, again, no one solution is going to cover every need. Now, as far as translation, translation can be outsourced to an agency, and they have freelance translators. That's good because, for example, you don't have to have the resources in-house to have everything translated that you might need. The downside to that is that outsourcing translations can be expensive. Going through an agency to get stuff translated can be very expensive. The other option is that if you had a competent translator that worked within your organization, he or she might be able to do the translations. But again, that would depend on the size, the scope, and the mission of your organization. The question is there room for students and learners in this multifaceted approach? And I would say, of course there is. Students and learners are a great opportunity, and they're a great addition to organizations. But again, the degree to which you include students and learners depends upon the size and scope and risk of the services that you are providing. And so
I just wanted to remind you we're up at the 5-minute point before the end of the webinar and beginning of the Q&A period.
Okay. All right. I'm going to run through this. So continuing implementing them, we want to talk about language proficiency testing. Okay, language proficiency testing should be validated. Okay, only a validated test is a test that is really acceptable. There are other tests out there, but there is only one validated test, and that validated test is given by ACFEL, which stands for the American Council of Teachers in Foreign Languages, and they have a testing wing that's called LTI, Language Testing International. They are an agency that gives a validated oral interpreter interview. This is considered the gold standard in proficiency testing. But I do want to say that we're not connected with them in any way. The only reason that I'm sharing this information is because it is the only validated test that is out there. There are other tests that are available, but they're not validated. And so the risk of using a non-validated test is that the results might or might not be accurate. And that's why we always want to go with a validated test. We talked about training, and so training is an important part of applying these standards to one degree or another, again, depending upon the size and scope of your organization. After training, there could be skills testing or more training, and then continuing education. And this is kind of a cycle. For individuals in any category that are working as interpreters, they should have training, they should have evaluations, they should have continuing education on a yearly basis. Remember that the initial evaluation of competence is really sort of a threshold. We're saying that, according to standards, are saying that they meet the minimum threshold, but there's still a lot more that they can learn and get better on. So the template that we are offering basically is, I want you to think of these three things as categories: it's screening, training, and testing. Okay, and this is what the template is. There should be some type of screening, some type of training, and some type of testing. And the New Brunswick Community Interpreter Project is what I direct, and we have used this same template, but we've used it in different ways. And so we've used it with students, or we call them paraprofessional interpreters, and we've also used them with bilingual staff members or dual role interpreters. And so we don't use the same screening, testing, and training for each group, okay, because it's tailored to that group and the environment that they work in. So our students work in primary care. It's a low-risk setting, and so they don't need to have the same extensive training that bilingual staff members who work in high-risk settings in a hospital have, for example. And so this is the template, and it works pretty well. As far as another credential, I wanted to mention certification. So there is certification for medical interpreters, but again, I think that this would apply equally in education and social services. And so these are the names. I just copied the logos, and I have the links a little bit later in the resource section. But these are the names of the two boards that offer certification. They're roughly the same. There's not one is better than the other. If you're interested in pursuing certification or having employees pursue certification, I would read up on both and make a decision upon which one you think fits your needs a little bit better. Both are validated. Both have been based on a job task analysis. So our screening for dual role interpreters, follows the template that we've done. It's initial testing, it's training, and it follows the prerequisites for certification. And so basically what we do is language proficiency testing. Candidates must score advanced mid or higher on the ACFL test. So the ACFL test works along levels. There's superior, advanced high, and advanced mid. They must score at least advanced mid or higher to be considered for training. And so basically that's the same prerequisite for certification. We do 40 hours of training, which includes training in medical interpreting and medical terminology, and approximately 30% of our course, the community interpreter, is dedicated to interpreting practice through role plays. So in our 40-hour course, we do as much to get people ready for the next step, if it be certification or some other verification of competency. Now, this is my resource section, basically. We've talked a lot about the National Council on Interpreting in Healthcare. This is a screenshot of their website, and their link is at the bottom. I'd just like to say that this organization, although it is called National Council on Interpreting in Healthcare, is really a stakeholders organization and encompasses policy advocates, social workers, researchers, doctors, and of course interpreters. And so it really has a wide net. It's really people who support and are excited about language access in general and developing language access not only in healthcare but in what is community interpreting. This is the website of the program that we are licensed to train, called the Community Interpreter. There is a lot of great resources here as well. If you look at the top here, Intersect, they have a weekly newsletter that goes out, and the weekly newsletter, to be honest, really tries to cover all areas of interpreting, so it's not a medical interpreting newsletter. It has a lot of great resources. There's usually a video, a story from the field, a book recommendation, and it's a really great resource. And I think that anyone interested in diversity or language access or cultural competency would really get a lot out of that resource, and it's free. The American Translators Association is the organization that certifies translators, and so if you wanted to get more information about that, here is the link that you could go to. Again, the organization that does the one validated testing, this is a screenshot of their website. It's called Language Testing International. If you wanted to get more information about that or set up a testing, if you look here where it says ProFluent, there is a way for individuals to take the test. It's sort of a secure proctored site online, so it doesn't require individuals to go anywhere or have any special technology or any special setup. It's a pretty nice thing there. Critical Link is an academic conference that happens every 2 years. And it focuses on community interpreting. It's an international event, and it sort of showcases scholarship and other academic resources and publications around community interpreting. So I'd like to include that. I think that's really good. Their next conference is in Scotland next year, so maybe, I don't know, vacation, Critical Link conference would be great. And then lastly, the International Medical Interpreters Association is another great resource for people interested in medical interpreting. This website has a whole lot of resources. It does have a providers division as well. I mean, this tends to be pretty medical, but it does have a providers division, and so people could join if they are providers. But if people who are interested in interpreting in any sector in community interpreting, I think would get a lot out of this organization, because there's just a ton of resources. For example, on this website, under I believe it's under Basic over here, but you can't see it, but they have sample job descriptions. So if you were interested in hiring an interpreter and didn't know how to come up with a job description, they have a template job description that you might be able to use. That's an example of one great resource that you would find here. So, we've reached the end. I want to leave time for questions. We have 5 minutes for questions. But my big takeaway here is the 2 T's, basically what I call it, is that if you're thinking, yeah, I want to apply these CLAS standards and other standards in my organization. It sounds great. That's where I want to go. That's where I want to take my organization. I want you to think of the 2 T's. The 2 T's are the greatest way to start. And the first T is language testing. So if you have individuals that are interpreting, your bilingual staff or hiring other people, you want to make sure that they are confident in the language that they're doing. So that's the first T, should be language testing. And then the second T is training, because being able to speak a language is one part of being able to be an interpreter. You need training in that other part, the code of ethics, the standards, the note-taking, the practice of interpreting, all the basic skills of an interpreter. So if you come away with nothing else, and I hope that's not the case, but if you come away with nothing else, I really want you to come away with the two T's, is that testing and training is the most effective way to start any language access program. It's the most effective way to start your development and application of the CLAS standards.
Well, Hank, thank you so much. That was a very rich presentation, a lot of useful tips and suggestions and resources, and hopefully it provides a template for important change in the kinds of services that we provide. We have a number of questions here, and I'm going to suggest that we continue beyond 11 o'clock, maybe by 5 additional minutes, so that we have a full 10 minutes for all the questions that have come in since we had our last round of Q&A. So let me begin with a question related to where and how training can be taken. One person wants to know if there's such a thing as online training, or does everything have to be done in person? Can you address that?
That's a good question. There are online trainings. I believe the University of Amherst, Massachusetts, has an online medical interpreting course. There is a university in Canada, Glendon University, that has a master's level translation program. They have an online interpreting course, medical interpreting course. I don't know if you can take that course separately from the other ones in the program. The Amherst, University of Amherst offering does have, I believe it's a sort of a set-alone course. In other words, you don't have to register for a whole degree or something. There's that. I'll tell you that I'm working with Rutgers University to develop an online medical interpreting course. It will most likely be offered next summer, and that is a course that, again, you would be able to take. You could take it as part of a certificate, or you could take it individually. Those are the courses that I know that are online. NYU has a course that I'm not sure, it's not fully online, it might be partially online, a series of courses in medical interpreting. Some of them might be online or not. They have some online offerings. I think the medical might be partly online, partly face-to-face. So, there's a real challenge with doing interpreting online, because interpreting requires so much interaction. It's not just content-based where you can log on, read some slides, or read some articles and answer some questions. There's so much interaction, and so it's a challenge to recreate that interaction through an online platform, and it usually requires a lot of infrastructure and software and different things, and so that's why you tend to have bigger universities that have those kind of resources available are doing online.
Okay, that's great. We have someone who has turned to translation services and has been dissatisfied with the quality of the product. And so the question relates to how can you, well, they're actually looking for a recommended translation service. I doubt you're in a position to do that, but how can you be rest assured in advance that you're going to get a quality product? Do you have any suggestions for folks that have run into this kind of problem in the past?
Two things. Let me just clarify that you mean the translation as opposed written documents, right?
Yes, talking about written documents.
Okay, so and yes, I'm not really in a position to recommend any agency over another. What I would say is that you as the client, for example, you have every right to ask, and I would encourage you to do so, what is the competency of the people that they're contracting with? So, and this applies to both telephone interpreting or written translation. I mean, you want to know, how do you interview your translators, your interpreters? How do you know they're competent? What kind of training do they have? Because again, you're purchasing those services, and so I think you as the client have every right to ask those questions, and you want to make sure that whatever their answers are consistent with these standards, because agencies, that sell services should sell the services in compliance with the standards that we talked about. Mm-hmm. Is that always happening? I don't know. I'm sure it happens with some agencies, and with other agencies, it doesn't. But I think the easiest way to solve that would be ask those questions initially. Find out how they're determining competence.
We have another question, Hank, regarding maybe languages that are in short supply. Mm-hmm. And the questioner talks about Cantonese Mandarin and the difficulty that she has experienced in finding a competent Cantonese interpreter. So the gist of the question is, do you have to relax your standards for languages that might be in short supply in particular communities?
Yeah, that's a good question and a tough question, and I think, with regards to Cantonese or Chinese, I would say no. I would not suggest lowering your standards to try to find someone. I'm sure that there are qualified Chinese interpreters out there. I think the question is finding the right agency that might be able to provide that to you. One place you might look is and this is a state agency. The New Jersey AOC has a list of qualified court interpreters. You might, and they include some agencies on there. You might want to go to that resource to find some agencies, and some people are listed individually. And so, if they're listed on that registry, that court interpreter registry, it's a pretty good chance that they're competent. Other than that, I would say, whatever agencies you're contacting, I would just recommend what I recommended to the other questioner about translation, is that find out how those individuals are competent there. Now, as far as lowering your standards, I mean, the challenge that you might face, and we have this in New Brunswick, is how do we find interpreters for indigenous languages from Mexico? And so, we have patients who speak Mixteco or Nahuatl, and these are indigenous languages from Mixteco is southern Mexico and Nahuatl is northern Mexico. How do we find interpreters for those languages? And that is a real challenge because there aren't. And so, in those situations, it might be necessary. Unfortunately, this is just a reality of it. Of the way it is that lower your standards. Do the best that you can, so it's. I know that's a tough thing to say, but that's just the reality.
Well, I think we have many more questions that we can possibly get to. Right now we have time for only one more question, and I will refer all the ones that we didn't get to you, Hank, and hopefully you can respond offline. So the last question is, isn't it necessary to provide financial incentives to bilingual staff in order to pursue training? So do you have any experience here in offering incentives to staff to enable them to function as dual-role interpreters?
Financial incentives in the sense that the organization pays for the training for them?
I'm not quite sure. I'm thinking financial incentives to take on additional responsibilities within an organization.
Okay, well, let me say two things. One is that usually with the people that we work with, the organizations cover the training for their staff. So that's probably not what the question is. As far as once someone is a dual-role interpreter and they're qualified to do that, should they get additional compensation? I would say yes, 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 of course. The reality is in New Jersey they are not, okay? Most dual-role interpreters do so on a volunteer basis. They are not getting additional compensation. But I'll tell you that that's not the case everywhere in the country. In Indiana and at least that I know of, in Indiana and California, and there might be in other places, bilingual staff members who are qualified do get a differential based upon the time that they put in interpreting. So at the end of the month, they get, you know, I don't know, like, I don't know what it is, but it's like, it's a particular percentage of pay, like 0.6 of their pay or something times the time that they have interpreted additionally. So it's, you know, it's not a foreign concept. It's not a strange request at all. It's, people do get it in different parts of the country. We're not there yet in New Jersey, but, you know, it's a great idea, and I would love to see it.
Well, thank you. Thank you. This has been a really tremendous presentation. Thank you for a wonderful job. You've given us a lot of food for thought. And as I said, I can't keep up with all the questions that are coming in, so you'll have a nice list of questions to work on later. So on behalf of the New Jersey Statewide Network for Cultural Competence, I'd like to thank everyone for participating in today's webinar. We hope you will join us for future webinars and will participate in our fall conference, which, if you haven't heard, is scheduled for November 9th. Please don't forget to complete the survey, which will appear on your. Thank you all so much, and have a wonderful day.
Thank you very much, everyone. I really.
Muted.